Hi, this is Dr. Nathan Way, and today we're going to talk about the pros and cons of stem cells. And I'm going to talk about the four basic types of stem cells, the pros and cons of each, and this is mostly in relation to arthritis because I'm a rheumatologist, so that's what I know. The first type of stem cell is the embryonic stem cell. And the pros are that they're pluripotential, meaning they are capable of becoming any tissue in the body, and they're capable of becoming any tissue in the body very readily. It's pretty easy to convert these cells, and someday they may be very abundant, but unfortunately, let's launch into the cons. Right now they're difficult to get. There are multiple ethical issues involved because the major source of these cells are fetuses. There have been reports of malignancy associated with the use of embryonic stem cells because they grow so well. Sometimes they grow too well. And so far, the research related to different medical conditions using embryonic stem cells has been somewhat disappointing for whatever reason. So that's the embryonic group. So let's go on to the next group, the allogeneic donor cell. Now the pros with allogeneic donor cells are they're available now. There are many companies that have these donor cells. These cells are obtained from healthy young adults. These cells are multi-potential. Because these are adult stem cells, they don't have quite the ability to differentiate into different body tissues like the embryonic stem cells do, but they're still not bad given the right stimuli. And large numbers can be obtained because these donor stem cells are treated with different growth factors that cause them to multiply a lot. And this is done, of course, outside the body. Now, the cons are that there are unforeseen genetic issues related to these cells. We don't know where these cells come from. The donors are screened, but you just can't tell. Infection transmission is always a risk. The technique used to make these cells multiply is not really standardized, so that could be an issue. And finally, well, how many stem cells do you really need for a given problem? It may be that it's a bit of overkill here. So let's now talk about adult mesenchymal stem cells. This is the type of stem cell that is, first of all, readily available now. They can be obtained in sufficient numbers, 5 to 10 million at a time. These are harvested from the bone marrow of the patient. And so what we're using are autologous, meaning a patient's own cells. So there's no problem with rejection. There's no problem with infection or any of those other issues that could be seen with donor stem cells. The current protocols that are being used appear to be effective, although, again, there's no standardization of technique. So, unfortunately, different centers use different approaches, and that's unfortunate. Also, because these are becoming so popular, almost faddish, there are many centers that are jumping on the bandwagon, and their techniques may not be up to snuff. So, the stem cells, the procedure can be subject to abuse. There are no good double-blind controlled trials as far as arthritis is concerned, and that's a weakness. These adult mesenchymal stem cells are multi-potential, not pluripotential. So, again, these are adult stem cells, but again, if you place them in the right environment with the right stimuli, that's less of an issue. And probably the biggest con right now is, the biggest negative that I see is that the use of adult mesenchymal stem cells requires a lot of skill. Because it's not just a matter of dumping the stem cells into a joint. There are a lot of different things that need to be done in order to get to the point where they can be used for arthritis. So let's get to the fourth type of stem cell, and this is the one I find to be most exciting. And these are the induced pluripotential mesenchymal stem cells. These are obtained from adults, and what has been shown elegantly by a number of different researchers is that they can take adult mesenchymal stem cells and, by using various techniques, wind the clock back so that these cells then begin to behave like embryonic stem cells, and they become pluripotential. And some of the early laboratory work looks really exciting. So, the early data is excellent, and these types of cells probably have the most potential. But again, it's way too early to tell how these will play out. They're certainly not ready for prime time yet, but I think this is where the future is. Right now, though, we have adult mesenchymal stem cells, and I think that's pretty exciting too. Well, that's it for now. I hope you enjoyed it. This is Dr. Nathan Way. Thanks for watching.